depending on the number available, we put the embryos back inside the womb. So basically, by doing so, we create a chance for the embryos to implant. If they do, then a pregnancy ensures.
But as you said it, I think it's the most simplistic way of defining it. I mean, like, you know, would make you think, okay, taking this thing out, mixing it with this, and then putting it back in. So it sounds really so very, very easy.
For us, it's how it works, really.
But we understand that the cycle of in vitro fertilization, and for one cycle to go through, how many things and tests and trials, and I don't know how much of an effort is really made.
Indeed.
And with this, Dr. Abdullah, as we've spoken about in vitro fertilization with many of the guests who have come here and joined us in the program, so people understand that in vitro fertilization would be the ultimate resort for them, given if they are having constant failures. But nonetheless, when we talk about in vitro fertilization too, as there are pros and cons to everything, tell us about the risk factors, the complications maybe which are associated with in vitro fertilization.
For many couples going through this kind of treatment, it's indeed a very safe technique, and many do not encounter any problems whatsoever. Indeed, many have a very happy outcome and have what they usually what they dream of, a lovely, healthy child. However, some patients, although not many, do unfortunately encounter some risks and problems. So like any other treatment, IVF has got its own risks and complications. What actually matters is that the risks could be actually very serious. And,
very serious?
Indeed, yes. And for people who literally have no kind of illness. So to go from the suffering of childlessness, infertility, into a treatment that ends up in a serious complication, obviously, is something very devastating. Now, I don't really want to scare people from, you know, the kind of treatment that we provide, but I feel it's very important that people know, both practitioners as well as patients going through this kind of treatment. To begin with, the procedure itself is done in stages. If I can have a look at the first image, I think that will help us explain
we are
this.
so sorry, but I think that you have brought it in the images. We're having
technology problems.
The computers.
Right.
But if we can, Dr. Abdullah, we're going to talk about it more in detail in another edition, perhaps, where you can show us the pictures and show us more of the details, as we apologize for the small technical error that we are encountering with putting those images. But who are the people who are likely to have risks and complications from in vitro fertilization?
Right, okay. To begin with, let me just mention, you know, quickly the kind of stages that ladies have to go through, or couples have to go through for this kind of treatment. The initial stage is usually stimulation of the ovaries by giving injections to help more than one egg develop into the ovaries. The second phase or stage is the one that we remove the eggs outside. This is what we call an egg collection procedure. Then comes the laboratory part, and we then put the embryos back. So there is a procedure for transferring or putting the embryos back. Okay. And finally, obviously, there is a kind of a problem or problems that could occur as a result of the treatment itself or the outcome of the treatment itself. Now, the initial stage, the stage of giving medications or taking medications to stimulate the ovaries to grow the eggs, is a very important one for the success of IVF, because basically when the procedure or the technique was introduced initially, there were no medications, okay, and people relied on getting hold of the single egg that we know is usually ovulated roughly on a monthly basis in ladies. And that was a bit of a luck, you can say, because sometimes, you know, it's very difficult to get hold of the one egg, timing, procedures, and the rest. The success rate was very low at that stage. However, with the development of the techniques and medication, then the introduction of this kind of injections helps to maximize or improve the pregnancy rate or the outcome by growing eggs. We need to be careful as practitioners and ladies need to be aware of what could happen to them as a result of taking the fertility medications. Now, they are usually taken in the form of injections on a daily basis, okay? And one of the very important things to help us minimize the possible risks is to monitor the treatment. So we monitor the treatment, we know what's happening at every stage of taking the injections, because basically some ladies do not, respond well, okay, and produce enough eggs, and at the other end, some ladies do actually respond excessively and produce far many eggs than what we would like to see. The average perhaps is like 5 to 15 eggs or so, but some produce 20, 30 or even more.
So there is risk of multiple...
Absolutely. The risk actually comes from the fact that the ovaries would usually enlarge enormously. And if that continues, the trouble will be some physiological changes occur and fluid can actually ooze out of the ovaries, ooze out of the lining of the tummy and the lining of the inside of the abdomen and chest. Basically, that can lead to a condition called hyperstimulation syndrome. This hyperstimulation syndrome usually occurs in a mild form, and ladies usually have some form of tummy discomfort, some aches and pains, feeling sick, being sick, this kind of things. However, the serious degrees cause enormous discomfort, problems with breathing, shutdown to the kidneys, and sometimes very serious chest problems, and ladies may end up going into ICU units, intensive care, and so on and so forth. Fortunately, this severe degree is not that common.
Yes, please tell us about the percentages.
Because I was about to say, after what you said, no one is interested in doing IVF unless it is the last and only choice.
This kind of complication occurs in a severe degree roughly in around 1%.
Of
patients,
so
or less than 1% of patients, roughly.
But let us know one thing, Dr. Abdullah. When a female comes to your IVF unit and you find out, I mean, not a female, they say couple, I guess, usually. So if a couple approaches you and you see the details and things as such, would you be able to predict it at a very early stage that these are going to be developing into complications and this couple is likely not to benefit from the treatment or may develop risks or complications from the treatment?
It's very important that we take that into account. The very important factor is age. Ladies' age, young age is a risk factor. And one of the common conditions, especially in our societies here, is a condition called polycystic ovary syndrome. Ladies who have got these polycystic ovary syndrome problems are actually at a high risk of having this condition. The other thing is also, if ladies had previous treatment, like what you've just said, it's important to take the outcome of that treatment into account, because ladies who responded too well, produce many follicles, will be at risk of this condition. So yes, we can predict that, and yes, we can do something to help avoiding the whole condition. They need careful monitoring, and we start the stimulation gently with small dosages of the medications usually.
And Dr. Abdullah, after like the IVF is succeeded and the woman is pregnant, is there any risk upon pregnancy?
Absolutely. If we think about IVF, obviously most people who approach us think that, once they have the treatment, wow, fantastic, that will work, pregnancy will be, problem-free, and so on and so forth. It's important to realize that once a pregnancy is achieved, it's more or less like a natural conception. It's just like a normal pregnancy. So it's born to have various sorts of complication problems that any naturally conceived pregnancy is born to have.
So there's no difference between the two?
In fact, in some aspects, IVF complications could be, or IVF pregnancies could be more risky, not because of the IVF technique, but because of the population of ladies who come to have IVF. Okay, they are different somehow from the general population. So yes, there are risks. Miscarriage is a risk. What we call a biochemical pregnancy. Pregnancy could be detected by measuring the hormone in the blood, but when we do scans to find where about the baby is, we don't see that. So pregnancies ending up in a loss at a very early stage is one of the problems. Ectopic pregnancy is another complication. We know we put the embryos back inside the womb. Okay, surprisingly, still roughly around perhaps 2 to 3% of IVF pregnancies end up in ectopics. Ectopic basically mean the embryo implants outside the womb, commonly in one of the fallopian tubes, which are attached to the uterus. So people have the belief that, you know, we put the embryos in the right place. Why should they go? Why should they implant outside? Is it a doctor problem? Did we put them there? But generally speaking, these days most physicians use the technique of ultrasound guidance for putting embryos back. We know we put the embryos in the right place, but somehow...
And very, very briefly, if you can just say that, how can we avoid the risks?
To begin with, I would recommend or advise ladies or couples going through this, you know, kind of technique to be careful about where to go. I think it's very important that you go for a specialized place where staff are experienced, are qualified and dedicated, you know, to do this kind of
staff and technology.
That's number one. I think it's very important. It doesn't help if you go to any dispensary and you find, you know, someone who prescribes, you know, medication without, you know, appropriate monitoring. If any complication happens, they wouldn't be able to pick it up also. So number one, go for the right place. Okay. Number two, ask your practitioner, ask your doctor about, you know, the complications. So you are aware of what could go wrong. Number three, I think, be on the alert side. If you encounter any problems, any kind of symptoms, if you're not sure, ring back, communicate with your clinic or your doctor, and basically be seen at the earliest opportunity, because obviously even if a complication occurs, most of this could be, you know, managed appropriately if detected early. And you know, these are the kind of things which are really important. I think finally also a message to patients who encounter, you know, whatever kind of problem related to this treatment. I think you know, they need to listen carefully to what the doctors advise and recommend, because we do get patients who we recommend, say, like hospital admission, and they perhaps say, no, I'm okay, I feel well, and whatever. So I think, you know, that's
follow the
important.
instructions. And this is, unfortunately, some people are trying to avoid that thing. Thank you, Dr. Abdullah, for being with us, for giving us the time and being with us on the Saudi Morning Show.
Thank you very much indeed.
Thank you. And that was Dr. Abdullah Ibrahim Saleh talking about IVF and the risks and the possibilities of it. And for now, dear viewers, it's time to move to our last report of the show, and then we'll be back to conclude the weekend edition of Saudi Morning Show. Stay with us.